Hello there, and welcome to the latest edition of Compression Chronicles. Today we have a special edition. It's the JOBST Grant Alumni Series, and I'm so pleased to welcome the winner of the 2026 JOBST Clinical Research Grant, Madeleine Givant. Madeleine is a medical student at the California University of Science and Medicine, expected to graduate in 2028 with a strong interest in plastic and reconstructive surgery. Madeleine's passion for the field was inspired by her mother's double mastectomy, which led her to pursue research focused on improving reconstructive and lymphatic outcomes. Madeleine joins us today, having won the JOBST Lymphatic Research Grant. Madeleine, first question. What does it mean to win the grant for you? What does it mean?
It's incredibly meaningful. I wouldn't be able to take a dedicated research year without this funding. It's also a strong vote of confidence in the importance of lymphatic research. Being able to conduct research in an area that has historically been underfunded and underrecognized makes this award really impactful and reinforces my commitment to advancing care for patients with lymphatic disease.
So do you feel like because this is an area previously underfunded, do you feel like you're putting down a flag here? Do you feel like you're really highlighting this area?
Yeah, I feel like myself and as the greater team, Dr. Singhал's research team, we've really put down a flag in lymphatic research and demonstrated its importance in that the work that we're doing should be funded and should be respected and needs to kind of come front and center. The patients we work with, the individuals on our team, everyone is deeply passionate about this. And I really do think the work we are doing is almost revolutionary in a lot of ways. Our perspective on it is entirely unique to the field, having been so centered in anatomy, which I'll talk about a little more later.
Mm.
But yeah, it's been incredibly important.
So tell us about the project then, Madeleine. Can you summarize the project that you put forward for the grant?
Yeah, so the single lab, we have several avenues of research, two of which are NIH funded, and one of which is a biorepository where we collect surgical samples from patients undergoing lymphatic surgery. My primary focus is one of the NIH studies, which focuses on improving the understanding, diagnosis, and treatment of lymphedema by studying lymphatic anatomy and function using advanced imaging techniques. Specifically, we're interested in why some high-risk patients develop lymphedema while others do not, despite undergoing similar cancer treatments. And so by identifying anatomical and functional differences in lymphatic pathways, our work aims to inform earlier diagnosis, personalized risk stratification, and the development of more targeted surgical and non-surgical interventions for these individuals.
So the knowledge that you bring will give more tailored care for patients. Is that fair in the future?
Exactly. Yes.
Wonderful. Why do you think you were selected then, Madeleine? Why do you think your application was picked?
I honestly think it's because I'm a strong fit for the team and its mission. I work with a multidisciplinary group where the importance of our work is clearly emphasized and I think deeply felt by everyone involved. We remain focused on lymphatic diseases, which I think is something that's pretty unique for a plastics fellowship, especially in research. And that consistent focus allows us to ask meaningful questions and pursue work that has real impact for patients. I also admire everyone I work with and feel very fortunate to be surrounded by such exceptional physicians, therapists, and researchers. And furthermore, the lymphatic fellows who came before me are truly outstanding individuals, and I'm really honored to be a part of that lineage.
Wonderful. Next question, Madeleine. How will the JOBS Lymphatic Research Grant help you in your medical training?
Yeah, a bunch. This grant allows me to have protected and dedicated time for research during my medical training, which is invaluable in my opinion. It supports my ability to develop strong scientific skills, contribute meaningfully to publications, and deepen my understanding of lymphatic disease at a level that will directly inform my future clinical practice. The grant also reinforces my goal of becoming a surgeon scientist. That's something that's really important to me. I've always highly valued research. And my goal is to bridge innovation, research, and patient care.
Wonderful. So you, as well as being a surgeon, you also want to be researching and gaining knowledge and building the evidence base.
Yes, I think not everyone has to pursue research when they pursue being a clinician or a surgeon. But to me, I think I want to understand things at like the ground level. And I think research is really necessary for that. And I also think having the opportunity to pursue things from two different fronts, like the clinical front and the research front, it allows your brain to kind of shift in its dynamics. And I think they feed into each other really nicely.
Hmm. Science and progress.
Yes.
So your career choice is very personal. How important is it to have a passion for your work?
Yeah, I think it's essential for me. Passion comes from like 2 points, I always say. I think of it as intrinsic motivation and extrinsic motivation. Intrinsically, I'm really driven by curiosity and a lot of gratitude. I really enjoy problem solving and understanding things at their core level. And I think this internal drive is what has kind of sustained me through what can be a pretty demanding process at times. Extrinsically, my motivation is rooted in personal experience. My mother underwent breast cancer treatment and fortunately did not develop lymphedema, but other women I'm very close with in my life do live with lymphedema. And their experiences were what initially kind of set me on this path. And after working closely with this patient population for over a year now, my passion has only grown stronger.
So did you always want to be a doctor and a surgeon, and then your personal experience guided you in this direction?
So initially, I really thought I was going to be a researcher. I thought I was going to pursue my PhD. But in undergrad, I was very fortunate to work with an MD PhD, and I worked in their lab. And at the end of my 4 years working with them, they said, Madeline, I really think you're missing out by not becoming a clinician. I really think you should take a step back and consider this. And I don't know if it was like imposter syndrome, but I was like, oh, I'm not meant to be a doctor. Like that's not my role here. My role, I'm pretty introverted. And I was like, that's a lot of like public facing um stuff to be doing every day. But the more I kind of immersed myself in that culture, the more I loved it. And I saw that I would have like these genuine interactions with patients, which is not something you really get on the research side. And so that's why I kind of have a passion for both
Hmm.
and why it's so important for me to be doing both of these things at the same time.
I guess as a doctor, you are helping people instantly, whereas the research is more of the long game.
Yeah, it's like delayed gratification.
Yeah.
And you really, when you're doing the research and you're kind of alone in a lab, you still think about those people that you see every day in clinic. And so I think it like helps sustain the passion
Helps you
and you're like working
motivate
for
you
someone. Yeah.
in the research.
Mhm.
So uh, as a as an academic, how many journal publications have you worked on?
So, since I started a year ago with the team, I've been able to work on two published journal articles. We currently have four manuscripts in peer review. And in addition, I've presented 9 poster presentations, 7 podium presentations at the local, regional, and national meetings, and also was very fortunate to receive what's called the Joseph E. Murray Resident Award from the New England Society of Plastic and Reconstructive Surgeons in 2025. And that award recognized our team's work on deep lymphatic drainage through what's called the epitrochlear humeral pathway.
So you're certainly making a mark on your subject area.
Yeah, I'm loving it. Like I said, it's really it's a testament to the team and the fellows who came before me. There's this lineage that I talked about before, and every fellow gets to build on the prior fellow's work. And I think the most rewarding thing is like getting to call them up. Like I'm not sure if you ever met James, but he was my the former fellow. And I get to call him up and tell him that his work is going somewhere and what he started is like being continued. And I think that's not to be cheesy, but it's like a really beautiful experience.
So the grant is going to help you continue the legacy.
Exactly. Yeah.
Wonderful. So can we talk about your hopes for the future, Madeleine?
Yeah, of course. I think my hope for the future is to embody the work ethic, the curiosity, and the sustained drive that I see in those around me every day. Like I said, I feel incredibly fortunate to work with the team that I do, And this environment has strongly shaped how I think both about medicine and research. Dr. Drew Singal has been an exceptional mentor and is someone I admire deeply. He's shown me what a successful and fulfilling career in medicine can look like, one that balances clinical experience, meaningful research, mentorship, and genuine care for patients. And as I move into formal practice, I really hope to emulate those qualities and carry them forward in my career.
It's a question we ask every interviewee. So what do you do at the weekend, Madeleine?
Yeah, I really think balancing a demanding life with a slower and more reflective one is incredibly important. And it's something I do try to capture in my hobbies and pursuits outside of medicine. Creative activities like knitting, painting, and drawing, they allow me to slow down and be present in a way that I think complements the intensity of the work that we do in my training as a medical student. I also spend time with my fiance, my younger sister, and my dog. And I really think this helps ground me and that these relationships remind me of my roles outside of medicine. And I try and pursue those roles with the same intention and care I bring to the research and clinical training. And I think that's kind of allowed me to be a better person in all respects.
Wonderful. So, what was the last thing you knitted, Madeleine?
The current project I'm working on some color work rose
Oh,
mittens.
impressive.
Yeah, so
Is that
I
a sock or a mitten?
they're gonna be mittens. I'm still working on what's called like the thumb gusset, but they'll sit like this.
Impressive.
Yeah, it's been really nice. And it's good for the cold weather, which so it's functional.
Definitely. Well, thank you so much. Good luck with your career and also your knitting. Thank you, Madeleine. We've really enjoyed having you on Compression Chronicles.
Yeah, thanks so much. It was a pleasure.
Thank you.